Hi guys, this is Dr. Joff, and I want to share with you a story because the other year I had a very young patient, and when he was walking, nagtakiang siya maglakaw. He could not walk without limping, and he had initially pain in the groin, sa bugan. So, asa man ang bugan, it is ang punuan, it's right here. This is your groin area here. And guess what is in the groin area that I immediately thought nan my problem. So it is actually the hip joint. My friends, arthritis warriors, this is actually your hip joint. So your hip joint is in the groin. Sa groin, bugan, or punuan, sa singit. So again, this is not your hip. A lot of patients say this is your hip. The actual hip joint is in the groin area, in these areas. So this patient, he was limping, nagtakiang, he could not walk properly, and I immediately thought, this patient, naani siya'y problema sa hip joint. And yes, he did have arthritis at such a young age, 20 years old, arthritis of the hip joint, and he also had a medical condition, which is why he had very early arthritis. So here are the top symptoms that I see in my arthritis patients, especially those who have arthritis in the hip joint. So this guy has groin pain. That's the first symptom I want to make sure that you guys know. Sakit sa bugan, punuan, or sa singit po. This is where you have your hip joint, which is the ball and socket joint. Some patients have thigh and knee pain. This is called referred pain. The pain goes down to the thigh and down to the knee. It's type of a spasm. The third is limping. Patients nagtakiang, they cannot walk without limping. This guy is also with severe arthritis, and that's why he's limping. Another is stiffness and limitation of motion, especially early morning. You can see that aside from the normal joint on the left, you have severe arthritis on the right. Early morning, they're very stiff. So I hope this helps. I hope if you know someone with hip osteoarthritis, you come see me, Dr. Joff, because this patient is no longer having any pain. These patients have gone through surgery and they're walking without problems, no more limp, and it doesn't matter if the patient is very young or very old. We can try to treat them as much as we can to the best of our ability so that we can get rid of that limp, that pain, that stiffness, and give them quality of life. So I hope you know the symptoms of hip osteoarthritis, sakit sa bugan, sakit sa punuan, thigh pain, and knee pain is also a symptom. Sometimes it's referred to that area. You have morning stiffness and patients who are limping. Much love and respect. This is Dr. Joff.